are lockdowns effective? Do you recommend that any state or country do lockdowns going forward? And I think both of you advise strongly against it. Martin, do you stand by what you said, and have you been proven to be correct?
I do stand by it. I think it's obvious by now that these lockdowns and contact tracing en masse, they were not able to prevent a resurgence of the disease during the winter. And the problem is that the belief that pandemic could be suppressed through these lockdowns meant that in a lot of places in the world, people did not use focus protections of the old. They thought that the lockdowns would protect the old, but they didn't. So they didn't put in the standard public health message to actually properly protect the older, high-risk people. And I think that's very tragic, and it has led to many unnecessary deaths among our older citizens.
Jay, do you stand by what you said, and how do you think the last 6, 7, 8 months have borne out?
I think the lockdowns are the single biggest public health mistake in history. I think the lockdowns have as Martin said, have failed to protect the vulnerable. The lockdowns has led to many unnecessary deaths, both directly as a result of the lockdowns, and also indirectly through this misplaced faith in our ability, misplaced faith in the ability of the lockdowns to protect the vulnerable. We should instead have adopted a policy in most places. Should have adopted a policy that got rid of lockdowns and instead focused on people we knew to be truly vulnerable to the disease, older populations, people with certain chronic diseases, adopted policies actually much more similar to what Florida has adopted rather than the state where I live, California, which has relied on lockdowns to disastrous effect.
Professor Gupta, across the pond, I know that they've instituted a lot of lockdowns in Great Britain as well as throughout Europe. You've been critical of that. Do you stand by your criticism? How's it going in Britain now? Are you still on lockdown? And what do you think the efficacy of those lockdowns have been in Britain?
We are still under lockdown, even though we've vaccinated the bulk of our vulnerable population. So people are at the moment suffering all the costs of lockdown without there being any obvious benefits, should this have been the case in the first place, that there were any benefits. Myself and many others, including Carl Hennigan, have been warning consistently that these policies are detrimental, that they have a very high cost, and at least that those costs should be visible and on the table before any decision is taken. And focus protection, of course, offers a kind of solution to the stark truth that we in the UK cannot afford lockdowns, nor indeed, as indeed is the case in most of the world. And the other reality is that an imperfect lockdown is actually closer to a let it rip strategy than a focus protection strategy, which I believe is easier to implement.
Dr. Atlas, you were on the coronavirus task force at the White House for a time. I think the two things you were very forceful about was we shouldn't have lockdowns and we should have open schools. That was counter the prevailing narrative, certainly in Washington, and I know that they tried to rough you up for speaking those views, but you were very clear on that. Do you stand by your position then, and do you think the experience has borne you out?
Yes, I think it's clear for people who care about the data that the lockdowns, as we had talked about many times, were extraordinarily harmful. There's no question that people have, 40% of people didn't get chemotherapy, up to 78% of cancers didn't get diagnosed, people forego medical care for emergencies, all because of fear. And, we have a massive public health price to pay as we go forward. And then we look at the data, and the data is really clear that the states in the U.S., we have the comparison. We happen to have done the experiment because of Governor DeSantis here, and we can compare what happened. And when we look at that, the actual results, the facts of having an open state, which was Florida, versus these other states, we see when you look at things like excess mortality rate, which is the number of deaths over what you would have expected that year, and you take it during the pandemic, It turns out Florida beat 70% of the states. Okay, these other states did severe lockdowns. And when you look at Florida compared to California, I'd like to point out, California did 50% worse than Florida because of its severe lockdowns. And there are many statistics like this. The lockdowns were harmful. They were the opposite of what should have been done. We said it from the beginning, there's a massive price to pay. It's not just that they failed to stop the infection. The lockdowns actually killed people, destroyed lives, destroyed families, and in the end, vis-a-vis the schools, our country, more than any other country, frankly, was willing to sacrifice its children out of fear. And this is really one of the historic, epic tragedies, really, of what happened during the pandemic management. It was advocated by many of my other task force members to do the lockdowns. They got what they wanted, and it's a failure.
So there's, sometimes people will say, because I think what Scott points out are obviously some of the negative impacts when you do lockdowns, and some will say, you know, the cure can never be worse than the disease. But I think if you look at how this has progressed, the virus has progressed in lockdown states, what is it actually curing? Has it actually stopped the spread in any meaningful way? So would you say that, yeah, lockdowns are bad, but they are stopping the spread? Or it just seems to me that it just hasn't even stopped the spread any place, and so it's not a cure at all. Yeah, obviously it's providing huge negative impacts, but there's really not a lot of positive to balance it out when you compare the severe lockdown states to other states which weren't locked down, or other countries like Sweden, which adopted a different approach.
Yeah, I mean, the international evidence and the American evidence is clear. There's the lockdowns have not stopped the spread of the disease in any measurable way. The disease spreads by aerosol, by droplets. It's a respiratory disease. It's very difficult to stop. The idea of the lockdown is incredibly, I mean, in some ways beguiling. So if you just stay apart far enough, like rats in cages, we won't spread the disease. But humans are not like that. And to have that happen, we can't actually, in fact, what's happened instead is we've exposed working class people, we've exposed poor people to the disease at higher rates. The lockdowns have I mean, I'd call it trickle-down epidemiology, right? We've created this sort of this illusion that we can control the disease spread when in fact we cannot, and it's failed to do so.
Martin?
Yeah, already in the beginning of 2020, in February, when we saw the outbreaks in Italy and Iran, it was very clear that this was a virus that's going to be spread worldwide as a pandemic. And Dr. Gupta is correct that lockdowns is just a form of let it rip, but at a little bit of dragging it out more. And by dragging it out more, it actually makes it more difficult for older people to protect themselves because they have to do it for a longer time. So we have the let it rip is not a good strategy. Lockdowns is let it rip at a much slower pace. But the solution that we should have implemented from the very beginning is to utilize the fact that for COVID, while anybody can be infected, there is a more than 1,000-fold difference in mortality risk between the oldest and the youngest. So for all people, have to be very careful because this is more dangerous than the annual influenza, but for children, this is less dangerous than the annual influenza. So we should have utilized that feature of COVID to protect the old with focused protection while letting younger people live normal life to avoid all the collateral public health damage from the lockdown, which are enormous. And I agree with Jay that this is the biggest public health mistake or the biggest public health fiasco in history, unfortunately.
Dr. Gupta, do you agree that, just put aside all the damaging effects of lockdowns, just taking them on their own, did they prove to be an effective way to stop the spread or slow the spread of the disease ultimately?
Well, what's interesting is if you take the data from a single region, I'm just reiterating what Scott just said, you can always fit a model which says lockdowns worked, look, cases went down, and you can fit a model which says, no, they didn't work. It was herd immunity. That's what caused cases to go down, and with some seasonality, you can fit the data from any one region by any one of these models. Where we get the power to discriminate between them is when we can compare. And that is something that the Florida situation has allowed us to do. And looking at Florida in comparison to, if you do a proper case control study with California, or looking at comparing Sweden against the UK, it's very hard to continue to believe that lockdowns worked to the extent that people wanted them to work. Now, it's not my area of expertise, so I think you've heard it from the experts that they don't work. But all I think is that whether they work or not, despite the fact that we actually don't have mathematical models, can't tell us whether they work or not. The data can, and in either case, it's focused protection that would be the strategy, whichever way the chips came down.
And just a reminder that I do need support to continue putting together all of this content, and at patreon.com/Ivor Cummins, or for PayPal at tinyurl.com/Ivor Cummins, where you can do a one-off or a monthly support. So I'd really appreciate that, guys, and keep me getting the science out there and countering perhaps the more biased corporate type science. Thank you.